NYC Health Hospitals and its food service provider Sodexo recently celebrated serving over 1.2 million plant-based meals since launching its plant-based meals program in 2022. Last year, which was the first full calendar year of the program, the health system served 783,000 plant-based meals to its patients, resulting in a 36% reduction in carbon emissions and a cost savings of 59 cents per meal. Patients who ate the plant-based meals also reported a satisfaction rate of over 90%. The health system initially began serving plant-based meals in 2019 with the introduction of Meatless Monday. In March 2022, it officially launched its plant-based meals program and gradually transitioned to serving plant-based meals as the default option to patients for lunch and dinner. All the meals are made from scratch at NYC Health Hospitals Culinary Center in Brooklyn and include black bean burgers, mushroom stroganoff, penne pasta with pea pesto and 3-bean chili. The Sodexo culinary team includes food services associates who, in addition to taking a patient's food order, also educate them about that day's plant-based options and
You know, what is authentic leadership? What is courageous leadership? And when I think about this celebration today, because that's what today is, it's all about a celebration, it's about leadership. It's doing something when others are not doing it. Do you have the courage to go out to those you serve and really serve something that they don't even know yet that they're going to appreciate? Dr. Katz, your team, I see Jordana, I see Graham back there. I don't know if some of the other CEOs made, but they're living it every day. So yes, you've set the vision with Mayor Adams and his office, but then we're following that leadership. That's called courage, and we thank you for that. When I think about Kate and Rachel and the mayor's office, you go back 2 years, we started on this journey, and without Mercedes Redwood and her team, do we stay that course? Did we have the courage to really attack it at every patient, every bedside? So with that being said, none of it would be possible without the talent that is in this building. So, and I love this guy because we've been on this journey a long time. And the problem with calling out names, and Sophie and Molly, I mean, you think about the footprint across this globe. We're showing that we can walk that talk. So, but in this building, I mean, this building puts out 18,000 meals a day.
50.
Yeah, you're in a working production area. So this is not just a press conference area. This is where we produce. And what I think is most important is that we are only on the journey. We have not reached our destination. And without the collaboration and with all of the tremendous teamwork that's happening with Dr. Katz and Mayor's office and Sodexo and this team, it would not be possible. So with that, I introduce to you Phil. He is our executive chef. Him and Sam and the team have been leading this for a period of time, and really looking forward to it. So.
Wow. Thank you, Matt. Today's an amazing day. I mean, we are so proud at Sodexo on being the creative partner with health and hospitals on this journey. And you know, people might think this is really difficult, but when you're changing lives, this is fun. It really is. We have a staff that constantly looks at what we're serving and the people that we're serving and create indigenous food from where they came from, their countries, their neighborhoods. Bring comfort food when they're not doing well, but comfort food that is healthy, that's going to help bring them back to what they're supposed to be and how to live. And it's enjoyable. I mean, you're going to see some things today and actually taste some things today that were created for our communities. One of the dishes that we're proud of is the sancocho that you're going to try, and everybody looks at you and say, you're making sancocho? Absolutely we are. Okay, we make our own sofrito where it starts from. If anyone in this room is from Hispanic descent, you know what good sancocho tastes like. Okay, Dr. McMacken can attest to that. She reminded me of her childhood growing up. That's what we're doing here. We want to make sure that people are eating not only healthy, but enjoying what they eat. Take a look around at the posters that are here of the food. This is the actual photograph of what goes to our patients. This is restaurant-style food that we're creating, tasty food, enjoyable food, and we're doing it for a reason. We're reaching the bedside. There's not a more difficult task for a chef is to create a vegetarian, or even more so, a vegan menu. We don't use that word, but plant-based, on their menu. It's easy to create a menu with meat, because when you learn classical cuisine, and I worked in France as well, okay, you learn to make sauces, and you aspire to be the saucier, because that's the final step until you get to the top. And the saucier makes a beautiful sauce, but what that sauce does, it enhances that protein. It's a lot more difficult to do it with vegetables. Trust me, I've been there. So today, I want you to please taste, enjoy, remember what we're doing, because we have a longer journey to go on together. But again, I couldn't be more proud to work for Sodexo and stand beside the Health and Hospitals team in this journey, because we're making a difference in a lot of lives. So thank you. Please enjoy the food.
Very exciting to be here with you today to celebrate. And so it is my first visit to the culinary center, but it's not my first visit to the I was here 2 years ago to visit one of your sites, and I'm really very, very impressed in the achievement and very proud of what what you've mentioned, that Sodexo is your trusted partner on such a visionary project, and that we also align with your values and with your ambition on this journey. I'm convinced, that collectively we can fix our food system. By 2050, there will be 10 billion people to feed, and more than today, and 800 million people around the world suffer from hunger. So, and yet, at the same time, 1/3 of what we produce is wasted. So I think, as a leader of in the food sector, Sodexo, and as a food organization, Sodexo, we have a major role to play to drive changes, because as I said earlier to Dr. Kras, we have an impact every day on 80 million people that we serve across 45 countries. And I think we have a responsibility to lead the change, and also to involve our stakeholders, our clients, our employees, our consumers, and our suppliers in this effort to reduce, of course, the carbon emission, and also throughout the value chain, from farm to fork. So part of that change is exactly what you're doing here. What we are doing together is about rebalancing the weight of animal protein in our plates. And I think it is our role, exactly what we've been doing for 2 years, to propose alternative and that are going to positively influence our guests, but also the planet. And as I'm saying that, I'm also aware that though we need to drive the change, and I'm very, I have strong conviction about it, we also need to remain very humble in front of the challenge ahead of us, because it's not that obvious, and so we have to be convinced, and we have to work together at it. So every day they create new recipes that reconcile pleasure and sustainability, and change the representation about plant-forward diets. So last year, 23% of our menus included plant-based main dishes. So that's a number, across the globe. So it's still low if we compare to what's happening here. But we have ambitious goals, and by 2030, 70% of our main dishes will be labeled low carbon, and of course with plant-forward recipes.
Thanks so much, Samantha. You know, all of the threads that have to be woven together to produce and have a moment like this are rather extraordinary. And we wouldn't be here without Samantha and everything that she does day in and day out to make sure that not just events like this happen, but that the meals continue to operate, that staff feel appreciated, and that we have the relationship that we do as a mayor's office, as a hospital system, as a private partner to be able to come together. So thank you. And for all of you, who have traveled, some just a little distance, for others quite a distance, to be able to be here and celebrate this remarkable moment. You know, I was mentioning earlier, like the nudges that are so seemingly simple, but to help us live our healthiest, most sustainable lives, we don't take advantage of enough. A simple nudge, like asking a patient, would you like this option? Would you like this plant-based option? It's really remarkable that it's taken us this long to be able to do that. But look at the incredible uptake of this program, right? We are seeing 1 million meals that have been served, and again, keep the patients who continue to choose those meals over others is the greatest testament of the success of this program.
Hey everyone, so glad to see you. Thank you for coming out to this wonderful celebration. I give a tremendous amount of credit to our mayor, who actually began this initiative as the borough president. And I remember at that time meeting him at what was then Coney Island Hospital, now South Brooklyn Health, the Ruth Bader Ginsburg Hospital, where we were tasting some plant-based foods. And the principles that he's made clear is, first, an incredibly inspiring life story, where he was able to turn around his health problems without medications, but through adopting a plant-based diet, which then made a major change in terms of his diabetes diagnosis. And the truth is, I had never thought a great deal before that time about hospital-based food. I thought a lot about food in general as a primary care doctor. Talking about making better food choices is part of my job. But I never thought so much about sort of the message of hospital food, right? Hospital food is just like a standing joke, right? You know the patients better when they're complaining about the food, right? The sense that it wasn't that important. And he really turned it around to me and said, well, what does it mean to patients' understanding of food if in the hospital you're serving them food that isn't the most healthful? What are you teaching them about their health? And I thought, well, you know, he's absolutely right. While people are in the hospital, we should be showing them what healthy food looks like. And the other principle, which I think Sodexo has done so well in collaboration with us, is he always says, and it has to taste good, right? The point, you know, every primary care doctor will tell you this about all of the advice that we give people, whether it's of exercise or of food. It's no good if the person won't do it because it doesn't taste good or it doesn't fit the rest of their life, because these are changes that you want people to make for the rest of their life, right? That's why any diet will work for 8 weeks. It doesn't much matter what diet you choose for weight loss. Any diet will work for about 8 weeks, and then it stops working because most diets are based on deprivation, right? And somebody can deprive themselves for 8 weeks. So you say, okay, I'm not having any beer, I'm not having any cake, I'm not having any sweets for the next 8 weeks, and almost anyone can do that. But at a certain point, you don't want to be depriving yourself, and so then people start going back to how they used to eat. This is a completely different idea, right? This is, we're going to give you food that actually tastes good, and that you will want to continue to eat because it tastes good, right? And it's good
To be here today in New York to celebrate, in Brooklyn actually, to celebrate a 2 years partnership between Health and Hospitals, the City of New York, and Sodexo. We have started a program on a more sustainable food for patients and and in the hospital. And today, after 2 years, we are celebrating a 1 million meal of more vegetarian, vegan, plant-based meal, and I think it is very exciting to have. It has been very courageous to start this journey. I think we had a great partnership.
We are incredibly excited to be serving our patients at health and hospital facilities plant-forward meals that really taste good. And we have found that when patients actually taste the plant-forward meals, they choose them consistently. We've had great responses. We know we're making our patients healthier, and we like the conversations going on between our doctors and nurses and our patients about why plant-forward meals are better for health.
So we're here today celebrating the 2-year anniversary of plant-based defaults within our public hospital system. We just heard that more than 1 million meals have been served to patients that are plant-based. And this is part of a plant-forward food policy that we have in the city of New York that is really inspired by Mayor Adams. Mayor Adams has a personal connection to this work. He was diagnosed with diabetes, and rather than taking a host of prescriptions to treat his diabetes, he wanted to reverse his diabetes and was able to do so by transitioning to a plant-based diet.